Well, hello everyone, Dr. Max here, and today's video is about the enteric nervous system, also known as the second brain, its various effects on your digestive health and the health of the rest of the body, and how you can help to rewire it or reprogram it to help with your chronic digestive issues. So disclaimer right up front, this presentation and the information within are for general education purposes only and do not constitute medical advice. So always seek medical care from your licensed medical provider if you're trying any new supplement, dietary plan, or other lifestyle intervention. Now that the disclaimer is out of the way, how best to learn this information? I recommend watching these videos in 7 to 10 minute chunks so you can take breaks, try to really retain the information. Make sure you're focusing on the video and the information. Avoid listening to this while watching other screens or doing something else. If you can, try to take notes. It's best to take notes by hand. The physical act of writing down your thoughts and notes by hand helps to engage more parts of your brain and your body so you'll learn the information better. At least try to take some notes by typing or on your phone if you can, because again, it'll help you retain the information better. Try to ask me any questions you may have. You can always reach out to me on WhatsApp or email or any other way that you can connect with me to ask questions, and make sure you rewatch this video multiple times because there will be a lot of information and you won't be able to absorb all of this at one time, and there's going to be a lot of good stuff that you may find helpful in supporting your own digestive health. So what is the enteric nervous system, or the ENS? Well, it's the 60 million plus neurons in your gut lining, all through the mucous membranes, the intestinal cells, just millions of different nerves sensing, listening to, and making digestion work. This does work separately from the brain. There is some crosstalk between the ENS, the enteric nervous system, and your central nervous system, which is your brain and spinal cord. But because so much happens in order to break down food and prevent infection and to make sure you're digesting and absorbing, that the enteric nervous system needs to have some autonomy. So it does a lot of the micromanaging and the little decisions by itself, and then leaves some of the larger systemic stuff to the central nervous system. The ENS will control motility, so how regularly you're having bowel movements, the absorption and breakdown of foods and nutrients, the sensation of stretch or pain or inflammation in the gut, the various secretions that we need, whether it's mucus to protect the intestinal lining, whether it's brush border digestive enzymes to break down food in the intestinal lining. It helps to control blood flow. You know, maybe during meal times we need more blood to come into the intestines to support digestion, and then at other times we're going to go work out and we need more blood flow to our muscles and less to digestion. And it controls a bunch of other functions as well that we'll get into. So does it really work on its own? Well, for the most part, yes. The central nervous system, your brain and your spinal cord, you can see here on the right, they help to modulate digestion, but the enteric nervous system, the ENS, actually executes those functions. So the central nervous system decides, okay, is it time to eat and digest? Is it time to work? Is it time to be stressed out because, there's a lion chasing us or we're about to get into a car accident? The central nervous system controls those things. But the enteric nervous system functions and forms those digestive reflexes without any input from the brain. Now, they both have patterns, they both have rhythms and cycles that are often related to the 24-hour day and night cycle. But what's pretty cool is that your gut has a mind of its own, which is why a lot of people call the ENS the second brain. Now, in terms of that communication, the main focal point between the gut and brain axis of communication, the vagus nerve, those vagal nerves coming from your brainstem down through your throat, and the innervate, all of the organs of the abdomen, but especially digestion. 80% of that communication goes from the gut to the brain. Only 10 to 20% of that communication comes from the brain down. So, what does that mean in terms of your chronic digestive issues? Well, if you're only focusing on your mindset and you're trying to manage stress from a brain only perspective, brain to gut, that I find that that rarely works because the ENS and the gut are making so many minute decisions constantly and monitoring things throughout the day. You really have to work on supporting the enteric nervous system in, I would say, most cases, if you really want to get that long-term resolution. So if you're working on trying to improve gut inflammation, you're trying to rebalance the microbiome, a much more effective strategy is to focus on the vagus nerve and the ENS rather than just general strategies that may work for other stressors, other life stress. See, a dysregulated gut rhythm can persist for a really long time, even after an infection or an injury has been resolved. The nerves have been damaged, the gut's inflamed, there are microbes, there's waste products that still need to be managed, even though, say, you got food poisoning, you cleared that out, now the gut and the nerves are still damaged and still need some time. And it can take repeated, stabilizing, regular input to help correct that. And that can take time. I like to have people think of this as like a strain sprain injury, right? And I'll explain why here in a second. So only focusing on taking antibiotics or a restrictive diet like specific carbohydrate, carnivore, GAPS, the low FODMAP diet means that you're only really doing the first step in resolving an issue. Say, for example, if you only wear a cast after a strain sprain, if you only use ice and take NSAIDs like Tylenol, ibuprofen, and once the pain is gone, you ignore the PT and the rehab to help re-strengthen and re-stabilize, say, an ankle sprain, the injury won't fully heal. And that's where a lot of chronic stuff, chronic pain, chronic issues can show up. So after an infection or the inflammation is gone in the gut, say food poisoning or dysbiosis, um, it can take weeks or months to rebalance a functional gut and nervous system if you're not providing those other signals to your body to say that it's safe to resolve inflammation, to rebalance things, and you're not showing to your body that you can heal. If you're still treating your body and your habits like you're really sick or stressed or inflamed, then the nervous system in your gut, the ENS, is going to reflect that as well. So here are 5 ways that your ENS will drive gut function and health so you can see why this is so important. 1, it regulates motility. So the ENS determines how often the intestines will expand and contract, peristalsis, and how often food is moving through the digestive system. That's via the migrating motor complex. And I find a lot of people with IBS or SIBO have a very dysfunctional migrating motor complex. Say they're constipated one day, and then they have really loose stools and they're going too much the next day, or they're getting a lot of spastic intestines and the intestines are having trouble relaxing or stretching too much from gas. The ENS supports the gut lining, so those tight junctions between your intestinal cells, that watertight seal that makes sure that nothing gets through like food, microbes, waste. The ENS helps to make sure that that stays nice and stable. A lot of different neurotransmitters are made and regulated and controlled by the ENS, including 90% plus of all of your serotonin, that feel-good neurotransmitter that we all need plenty of. 90% of that's made in the gut. And there are a bunch of others we're going to get into in a bit here. Pain. The ENS controls how sensitive the abdomen is to stretch, to inflammation, to bloating from gases, from hydrogen or methane, SIBO, etc. And it controls the immune function in the gut. There's a lot of crosstalk between the nerves in the ENS and all of the white blood cells and the lymph nodes in the gut, controlling whether you're creating inflammation to something, whether you're learning to tolerate foods and microbes, or whether you're trying to suppress immune function. So the gut immune loop, the function of mast cells. I like to bring this up because more and more people are dealing with symptoms of mast cell activation syndrome, MCAS. This is related to mast cells, which are a type of white blood cell, and eosinophils, which are another type of white blood cell. If you want to know more about those, watch my video on the immune system and immune function. Um, Mast cells have a huge effect on the enteric nervous system, and it can form this vicious cycle. So the mast cells um, will alter the ENS functioning by releasing chemicals like histamine, enzymes like tryptase, and other inflammatory signals. They release all this stuff saying, there's inflammation, there's danger. And the enteric nervous system, the nerves in your gut, respond by releasing hormones like substance P or neurotransmitters like acetylcholine and do a lot more. And so they can help to either perpetuate the cycle and continue releasing histamine and inflammation, causing damage because the body perceives that it's in danger, or the enteric nervous system can help to regulate and calm down these mast cells and say, no, 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 it's okay. We don't need any more histamine. We don't need any more tryptase. It's okay. You can relax. This is a huge influence, I would say, in a lot of my IBS cases that were from some sort of infection, especially really acute things, food poisoning, what have you. A lot of cases will deal with things like mast cell activation for months or even years after the initial infection is gone. Um, and the mast cells will actually alter the ability of those nerves, those neurons in the ENS to fire. They will change their behavior and will make the gut more likely to experience more pain, um, more pressure sensation, and alter your regularity. So it'll change the motility as well. Another gut cell that's very important here that can be overlooked are the enteric glial cells. So glial cells are these white blood cells that are found all throughout different tissues of the body. Depending on the tissue, they will have different names. Like in the brain, they're called astrocytes. In the regular body tissues and the bloodstream, they're known as macrophages. Um, Basically, they help to analyze and maintain the health of different systems. So these EGCs will maintain the gut barrier. They will modulate and determine how the immune system functions, whether it's creating inflammation, whether it's creating tolerance. They will respond to microbes. They will release nerve growing factors or pro-inflammatory signals, and that will alter the plasticity of the nerves in the gut. So if you're trying to heal, you're trying to rewire the nerves in the gut, if you can calm down those pro-inflammatory signals and help those EGCs release more of these nerve growing factors, that'll help to regrow nerves, reintegrate and resync the predictable patterns of the ENS. And because they modulate the immune function, they can either help you or they can harm you by promoting things like leaky gut, keeping motility dysregulated, keeping the gut inflamed because they still perceive a threat to the body. So you can see why these are absolutely essential when you're talking about chronic digestive issues, whether that's gastritis or SIBO or methane gas or even irritable bowel syndrome. Now, the microbes themselves, of course, also have a tremendous effect on the enteric nervous system. A few ways that they do that is microbes will break down various fats and fibers and turn them into short-chain fatty acids. For example, the most common and famous one is butyrate that you've probably heard me talking about. And if you haven't before, that's definitely a very important topic to look up and to develop some knowledge about because butyrate is absolutely essential for a healthy and balanced microbiome. Um, these short-chain fatty acids help to feed the lining of the intestine and feed the good microbes, the beneficial probiotics that are so helpful for keeping us regular and healthy. They support those microbes and the gut lining by stimulating energy production in the mitochondria. The mitochondria in your cells being the powerhouse, the power plants, where 90+% of all your energy is made. So the short chain fatty acids, butyrate, propionate, acetate, they help to support making more energy in the gut. The microbes do something we call quorum sensing. So basically, depending on the density and the makeup of the population of the microbes in your gut, they will send out different chemical signals saying like, oh, we're really overpopulated, or we're competing against these things. Um, so they'll send out things like antimicrobial compounds. Certain probiotics will do that to crowd out some pathogens, which is pretty cool. Or they will create biofilms around themselves to protect themselves from things like antibiotics, antimicrobials, to protect themselves from other microbes or pathogens or parasites that might want to break them down and use them instead. Pathogens and certain bacteria, of course, like if you have too much E. coli in the intestinal system, they will release a lot of pro-inflammatory signals that can lead to nerve damage. The classic one that you'll probably remember from my digestive video is lipopolysaccharide, LPS. This is from gram-negative bacteria. We have a lot of different types of gram-negative bacteria in the gut normally, but if you have an overabundance of that and you get an overabundance of this LPS in through the lining of the gut, if you have leaky gut and then it's flamed, it can get into the bloodstream, into the lymph, go systemic, and that can create all sorts of systemic issues: gut pain, joint pain, brain fog, headaches, fever, histamine release. So you can see how some of these pathogens and bacteria have an incredible effect on the nervous system. And at that point, it's not even just the enteric nervous system. If it's getting systemic, you're talking about the central nervous system as well. And then also the microbes will produce, byproducts, waste products, not just the short chain fatty acids, but some of them will produce gases like hydrogen or methane. Microbes will ferment fibers and produce certain gases, and this can alter the pH balance, the acid-base balance in the gut. In the large intestine, we want it to be slightly acidic, and certain microbes will create gases like methane and hydrogen, which makes the colon more alkaline, more basic, and that creates more gas, more pain, can slow down motility, can really speed motility up. So you can either get constipation, diarrhea, or alternating between the two. And of course, that stretching, bloating, gas can create a lot of pain. Now, the microbes are also communicating with our nerves in the ENS, and depending on their signals, that can have a huge effect on the gut. So the beneficial microbes, certain probiotics that you'll find, certain keystone species like Akkermansia muciniphila, Faecalibacterium prausnitzii, Lactobacillus species, Bifidobacterium species, certain probiotic yeast like Saccharomyces help to support the function of your enteric nervous system by producing short-chain fatty acids, acetic acid, lactic acid. Those short-chain fatty acids, as we talked about before, butyrate, propionate, acetate, will feed the gut mitochondria and feed the beneficial microbes there as well. So they help to maintain a healthy population. Say, for example, you take a bunch of probiotics, they have a bunch of lactobacillus and bifidobacterium in them. Well, those probiotics will only survive a few days in the gut unless you're giving them the food that they like. So short chain fatty acids, prebiotics, fibers can help to feed them, and so that they will stay in the gut and help to reshape, rebalance, and maintain a healthy microbiome. Bacteria, again, communicate through this quorum sensing, which will interact with your enteric glial cells. Remember those gatekeepers we talked about that determine whether you're going to have inflammation or whether you're going to have tolerance, and the sensory nerves in the gut, because again, the ENS is 80% gut to brain, so it has a tremendous effect on your response to digestion rather than the 20% coming from the brain down. And these microbial signals will either calm or stimulate the gut neurons. Now, when it comes to dysbiosis and imbalanced microbiome and how the gut responds to stress, certain pathogenic, unhelpful, or disease-causing bacteria, for example, a big family of different types of bacteria that we know that can create inflammation is called proteobacteria. And under this family, there's a bunch of different types of genus and species, E. coli, Klebsiella, a lot of really common ones that you'll see on things like a GI map or a stool test. These proteobacteria are known to create more pro-inflammatory signals. And if you're the kind of person who's not making enough stomach acid, or you're not chewing your food thoroughly enough, and microbes are getting down into digestion without being sterilized or broken up, or you're getting a lot of chronic postnasal drip, say from a sinus infection or a gum infection, these pathogenic bacteria, proteobacteria, can get further down into the gut. And we know that classically, when it comes to SIBO, when it comes to IBS, more proteobacteria will create more of those pro-inflammatory signals, and we'll have more things that irritate the immune system in the gut, like lipopolysaccharide, LPS. They'll actually damage these nerve endings. They'll damage and inflame the enteric glial cells because they're releasing more inflammation. They're irritating the system. And over time, this imbalance will disrupt your motility as well, because those pathogenic bacteria that are part of the imbalanced microbiome, the dysbiosis, will try to maintain their own populations, right? They want to survive just like we do and just like the good beneficial microbes do as well. So they're going to try and change the terrain, the environment, your microbiome to better suit their needs. So if it's, you know, microbes or archaea that create methane, a certain gas that can create more bloating and slow down digestion, that's more optimal for them, because then you're not going to the bathroom as much, you're getting more constipated, and they can maintain their position. And of course, when you alter your motility, when you're getting really backed up, or you're going so often you're getting really a lot of loose stools or a lot of mucus in the stools, that altered motility will prevent resolving the dysbiosis and prevent rebalancing the microbiome itself. And that becomes a vicious cycle. So when the ENS breaks down, these issues can kind of perpetuate themselves. A few common things I see: antibiotics. A lot of clients I work with have been on round after round of antibiotics, especially if they've dealt with SIBO for a long time. Typically, they're really strong antibiotics too, like a combo of neomycin and rifaximin. Or now I know the latest guidelines are to use things like Bactrim right away or Cipro, which are really intense antibiotics that don't I personally don't think that that's a good long-term solution, because the antibiotics will not discriminate. They will kill the good and bad bacteria as well, the good microbes, the bad. And every time you have to go through a round of antibiotics, certain species that were probably benefiting you are extinct. They're gone forever. And when you have less microbiota, less microbes overall, that's fewer signals to your enteric nervous system, which can keep things dysregulated. Changes to your gut motility will alter pain signaling, which is really common in people with IBS, constipation, diarrhea. They can develop what we call visceral hypersensitivity. So because the nerves in the gut, the ENS, have become sort of chronically activated and inflamed, they will start to perceive more things as a threat, or even just innocuous things as a threat. So if you have a meal that's maybe just slightly bigger than your gut can handle, it's going to create more stretch. And even something as simple as that stretch sensation can create a pain response, because the ENS has become hypersensitive. That inflammation, as I said before, activates the enteric glial cells. And when they're activated, they're the gatekeepers. They'll release a bunch of pro-inflammatory stuff, which will damage the nerves and can even create neurotoxicity and kill off some nerves in the enteric nervous system. Stress as well will lead to vagus nerve dysfunction, because the vagus nerve helps us to switch from that stressed out fight or flight nervous system response down into the parasympathetic calm, rest and digest nervous system response, which is what we need for a healthy gut and a healthy circadian rhythm. And when the vagus nerve becomes dysfunctional, that brain to gut connection kind of goes silent, and then the ENS will start to lose some of its function. Because even though the ENS works semi-autonomously, if the gut is inflamed and then you're also really stressed, the brain to gut and the gut to brain connections become dysregulated. So you can develop a sort of constant vigilance where the gut will remain guarded even after you've kind of calmed things down, or you've removed an infection, or you've, tried to rebalance the microbiome in some ways. Because that chronic stress will alter the patterns of the enteric nervous system in more of a long-term way. So that trauma, whether it's from an injury, an infection, stress, sometimes even just long-term mental traumas, PTSD, what have you, will change the ENS and program it to protect itself and to remain constantly vigilant. So you'll have that hypersensitivity. Motility is going to be really guarded even after you've removed the infections and you're trying to engage some of those safety signals again. So you will need a period of time where you have those stable, predictable, helpful inputs for your nervous system, for the gut. And we're going to go into more specifics about that here in a bit. But I find that a lot of my clients will still find they have a lot of hypersensitivity, or if they dip a toe out of their approved diet list, they start to get symptoms again, like bloating, gas pain, and then the stress of that is another vicious cycle. The gut has become constantly vigilant, and we end up training our nervous system to perceive any slight change in those symptoms as a sign that something is wrong. And oftentimes, if you're doing the right things, looking after yourself, changing your diet, your lifestyle, managing your stress, rebalancing the microbiome, we have to retrain our bodies to be able to calm that down and to be able to manage slight discomforts, because in order to heal, we need to get down into the rest and digest, and we need to be able to manage little bits of discomfort here and there, hopefully in a more stable, predictable, safe environment, and then gradually that can improve over time. Now, when it comes to the chemicals and the hormones that are made in the gut, as I said before, 90% plus of all the serotonin you have in the body is made in the gut. So rather than say, a medication that will help to keep serotonin in the brain and the gut for a bit longer, if you can help support the gut and heal the gut, then your microbiota, the microbiome and the ENS, should help you produce more serotonin anyway. Other chemicals that are made in the gut include melatonin. A lot of the melatonin that we need to help our nervous systems drift off to sleep is made in the gut. A lot of our dopamine, I believe it's about half of the dopamine, the last literature I read anyway. GABA, that is an inhibitory, calming neurotransmitter when we're sort of like really lit up. GABA helps to calm things down, shut things down, just relax, kind of helps to power things down. And acetylcholine, if you remember from my video about inflammation and from the vagus nerve, is the main neurotransmitter used by the vagus nerve to help stimulate that anti-inflammatory pathway through your spleen. So it's, very anti-inflammatory, supports digestion. Acetylcholine can be very helpful. And that should have a T after the E, so that was a typo there. Other hormones made in the gut, um, gastrin, which is related to stomach acid production, cholecystokinin, which is related to the production of bile in the liver gallbladder, and is related to pancreatic enzymes that help to break down food, like amylase for carbs, protease for proteins, lipase for fats, ghrelin, which is related to insulin and how much food we take in and how much sugar we can manage, as well as GLP-1, which we all know helps to regulate appetite. And now a lot of people are taking things like Ozempic, Wegovy as injections or as pills to help lose weight. So those hormones are all made in the gut. And if you have a dysbiosis, an imbalanced microbiome, this will shift production, alter neurotransmitters. And these shifts can even worsen when there are other situations where hormones can fluctuate up or down, such as during a menstrual period, when people are going through puberty, or in later life, especially for women when they're going through menopause. Men will go through another process called andropause, but for them, it's typically not as severe or noticeable as menopause. Again, Are we talking gut to brain or brain to gut? What's the best way to approach this? So 80 to 90% of the fibers are going from the gut, the ENS, up to the brain. The brain stem helps to integrate those nerve signals and will modulate gut tone. So if you have low vagal tone, if that connection from your brainstem down into your gut is dysregulated or not very powerful because you're constantly in a state of fight or flight, you're not only going to have poor motility, more pain, more dysregulation, um, you're also going to have a harder time just healing in general because you really can't heal when you're in that fight or flight state. If you want to calm the gut and you want to heal long term, you have to be able to get down into the rest and digest. So, because we know 80 to 90% of the fibers are going from the gut to the brain, from the ENS to our CNS, if you can support the gut itself and do some of the strategies we're going to get into later in this video, you have a much better chance of being able to support that vagus nerve long term. So you think about some people will use vagal nerve stimulators. These little devices will actually put on the neck or the ear to directly stimulate the vagus nerve. That's helping to turn back on that parasympathetic nerve response from the gut to the brain. Now, when it comes to the gut, there is a lot of what we call plasticity, which is changes in the nervous system and the growth of neurons and nerves in the digestive tract. And that can be for good or bad because chronic stress, chronic dysbiosis will lead to the nervous system developing a maladaptive pattern that'll keep you feeling hypersensitive, keep your motility a mess, keep you in a lot of pain. Um, and that's where, symptoms of IBS, constipation, SIBO, gastritis come from. So what this means is you can't just use antibiotics or a restrictive diet. You need to help to retrain your enteric nervous system. And this strategy can be a lot more effective for people long term. Now, the good news is you can rewire and regrow these nerves at any time, and this can occur at any point in life. It is easier when you're younger and typically takes a shorter amount of time, but we've all been through traumas. We've all had our unique life experiences, our exposures to infections. So it can be very individual. But the important thing is that we all have lifelong potential to rewire and regrow these nerves. I know that I'm a living example of this. A lot of my clients and patients are examples of this because with the right support, you can actually improve these things long term. Some of the tools will include short chain fatty acids, like we talked about, butyrate, propionate, acetate, vagus nerve toning, whether that's breath work using a direct stimulator, and other things to help calm down inflammation overall. Certain nutraceuticals can do that, like omega-3 fats, turmeric, curcumin, boswellia, certain types of probiotics, um, or other things if you have other forms of inflammation as well. Like if you really do have to kill off an infection and then rewire and rebuild the enteric nervous system. Tools you can use. I mentioned the vagus nerve stimulating devices. Some common ones that I often hear about people using, and I've had some clients have success with these, are the Pulsetto, the Truvaga, or the Sensate. Some of these will have an app that you connect to your phone and will stimulate the vagus nerve in time with like spa music, essentially. There are other devices where it's microcurrent and you can feel that on your neck and your vagus nerves. There are other ones where you just put a device right up to your neck. I have a patient who doesn't want anything that connects to a phone app, so the Truvaga has been helpful for her. The short chain fatty acids, as I mentioned before, what are some sources of those outside of just taking them as a supplement? Resistant starches are a really great way to get that. A cool life hack, if you don't know this one already, is if you make white rice or make white potatoes, we consider those very simple starches. So if you eat a bunch of white rice, that's going to spike your blood sugar because it's basically just pure starch and sugar. But if you take that white rice, put it back in the fridge, or take those white potatoes, put them in the fridge and let them cool overnight that cooling process will change a lot of the starch in there from a simple starch to a resistant starch. So what that means is it's not actively broken down in the stomach or the upper intestine. When it gets to the lower intestine, your colon, the large intestine, in that environment, those resistant starches act as food for those beneficial microbes. So day-old white potatoes and rice, excellent source of resistant starch. Certain prebiotics, chicory root, inulin, can be very good ones. XOS, GOS, FOS, all types of oligosaccharides that are very common prebiotics that you'll see in a lot of, say, children's probiotic gummies will usually have a little FOS in there, as well as certain dietary fibers, depending on what you can tolerate. Because, of course, a lot of clients come to me and they're eating very few foods. They've been traumatized and they've had to whittle their diet down to just 5 to 7 things that their gut can tolerate. And unfortunately, in many cases, those foods don't have a lot of dietary fiber in them. So the good microbes in the gut are not getting a lot of fuel that they need. So finding ways that we can slowly implement even just the tiniest, eighth of a teaspoon of fiber, or sometimes even less than that, just, like a pinky tip covered in prebiotics or fiber can be enough to start just to try and work on those messages and those signals to indicate to your ENS and your microbiota, no, it's okay. We can handle certain fibers. We're going to slowly work our way through this, try to build some more trust with stability and regularity. Breath work can be very helpful in terms of stimulating the vagus nerve, unless you're using a device. Deep belly breathing, breathing into your diaphragm at the bottom of your ribs has the most research evidence to support the vagus nerve toning. But other mindful practices like meditation, Tai Chi, yoga, as long as it's slow and intentional and mindful, can also help to stimulate the vagus nerve and get you out of that fight or flight. There are certain biofeedback machines that can help you to train your body to notice when you're feeling a lot of stress or tension. Say, certain biofeedback machines will have little electrodes that will emit a sound when there's a lot of tension in muscles. And as you learn to relax your muscles, the tone that the machine emits will change. So you can tell when your body is feeling less stressed. Because some of us have been stressed for so long or have been dealing with traumas or issues for such a long time that our bodies don't really remember what it feels like to be calm and relaxed and safe. And so those biofeedback machines can be really helpful to get us more embodied out of our heads and back into our bodies so we can feel what that's like when we're actually relaxed. Some of the vagus nerve stimulating devices have an aspect of that as well. Another thing I wanted to mention is heart rate variability. So people that have been very stressed or traumatized, dealing with a lot of inflammation, tend to have lower heart rate variability, which means that their hearts are beating and pumping at a very predictable rate. And what we want is our heart rate to be able to go up and down throughout the day. The more variability you have in that, there are times when you can rest and lay down. There are times when you're standing up and going for a run. Um, the more variability you can have that in that way, the more robust and resilient the nervous system and the better your outcomes in terms of longevity and supporting things like your ENS as well. And there are little devices you can wear. A lot of smartwatches will have a heart rate variability component to them, so you can see as you're working on these things if your HRV is improving or not. You'll often find that during periods of stress or when you're ill, the heart rate variability will get lower because the nervous system is trying to be more vigilant. So I've alluded to this a few times already, but something that's really important is to try to include some circadian strategies, creating more predictability in your day, and to be mindful of changes in hormones, especially for my female patients and clients. So estrogen and progesterone levels will definitely influence serotonin in the gut and your motility. I would say a lot of my clients and patients that deal with dysmenorrhea or painful menstrual periods will tend to get loose stools or diarrhea during their periods, at least during the first couple days. And that's because of those massive changes in hormone levels. And that's not just during periods as well. It's not just during menstrual periods. You'll also find that during, say, puberty that happens to everyone, or during menopause, or sometimes andropause as we get older. But anytime there's a major shift in hormones, say after a woman has a complete hysterectomy and they remove the ovaries as well, suddenly her body's not producing all of those hormones through the ovaries. She has to rely on her adrenal glands to create a lot of those hormones, and that can have a profound effect on serotonin production and motility in the gut. The ENS, just like our sleep-wake cycle, has a circadian rhythm. Um, and so predictability is the name of the game. When you're trying to heal the ENS and you're trying to resolve long-term chronic digestive issues, you need to create a predictable lifestyle and dietary pattern that your nervous system and your body can rely on. Improving your sleep hygiene, trying to deepen your restful sleep, will have a profound effect on the ENS and its circadian function. There are actually genes in the ENS and throughout the body that are related to our circadian rhythm. And the more you can improve your sleep hygiene and the more predictable you can make these things, the more those genes are upregulated. And that goes for some of my patients who really love intermittent fasting or maybe have an unpredictable schedule, or say they get stuck in their work and they're sitting on a computer and they forget to eat lunch. Missing a meal, having a late meal will stress and disrupt your migrating motor complex. If you remember talking about that, which is related to peristalsis, how often your intestines are contracting and relaxing, and how often food is moving through your digestive tract. So for some of my patients with really chronic SIBO or IBS or other issues like that, even if they've had success with intermittent fasting in the past, we may need to either stop that for a while or to change the window of when they're eating. Because if we're trying to get that long-term healing and to help rewire the ENS, we may need to have more predictable nourishment. Here's a case study I just wanted to share using some of these strategies of a woman I just worked with. And in fact, she still works with me every once in a blue moon because she had such a good experience. But this is a 34-year-old woman, moved to the United States from another country. So, already a bit of culture shock. But by the time she came to see me, had methane dominant SIBO from breath test, had very poor sleep hygiene, was staying up really late, even though her husband had to get up for work early. So she was staying up really late, sleeping in really late. She wasn't getting much exercise. Part of that was because at the time she worked with me, she was unemployed, but just had a very little regularity to her schedule, and she had a lot of different food intolerances. Was basically doing the low FODMAP thing, albeit a bit modified because she was vegetarian. But just a lot of common things I see with cases like this. She had had a history of multiple rounds of antibiotics and then multiple rounds of the herbal antimicrobials to try and resolve her SIBO and her dysbiosis, but it was still present, still had methane SIBO and ongoing stomach pain, upper digestive pain, this weird painful sensation around her belly button, and would get a lot of severe bloating and gas several hours after meals, which was really frustrating for her because sometimes it would be related to food she was eating. Sometimes it wasn't. Sometimes it seemed to be related to stress, but she just was really having a tough time dialing in what was causing this bloating and gas. Her labs also indicated that she was iron anemic, which isn't all that uncommon with chronic digestive dysfunction. When the lining of the gut comes dysfunctional, inflamed, when we get that leaky gut, suddenly it can be a lot harder to absorb and digest certain nutrients. And in the small intestine, where our intestinal lining is only a single cell layer thick, think about that, just one cell between you and all of the stuff moving through your gut, all the poo, all the waste, the microbes, foods, heavy metals, pesticides, just one cell layer thick. And that is where the body primarily absorbs a lot of its iron. So I see that a lot with a lot of IBS or inflammatory bowel disease cases. She had low iron and a salivary cortisol index where you check levels of cortisol at several points throughout the day showed that hers was spiking at night, which definitely wasn't helping her try to improve her sleep. Oh, excuse me. So some of the things we focused on when she was eating meals, we tried to make sure they were at more predictable times, that she was relaxing and focusing on her food, and taking a little betaine HCl, which is basically a stomach acid replacement with meals that helps to break down more proteins. It helps to lower the pH of the stomach to activate certain enzymes like gastrin to make sure you're absorbing vitamins like B12 and to make sure you're sterilizing the contents of the stomach so that all those microbes don't get down into the intestines, worsening things like SIBO or dysbiosis. We tried to give her a more regular bedtime and wake up time. She was a bit more of a night owl than her husband, so she didn't want to go to bed too early. She was still staying up later than him, but she wasn't staying up till, 2 a.m. Every hour of sleep you can have before midnight is worth 2 to 3 hours after midnight because a lot of that deep, restful, restorative sleep that we need in order to heal from injuries, calm inflammation, to clear out our organs needs to happen before midnight. If you stay up after midnight, then you're not going to get nearly as much restful sleep, even if you sleep a full 8 hours. So we had her get a more regular bedtime and wake up time, so that was predictable. We got a HEPA filter for her bedroom, one so she could have some white noise to help her sleep better, but two because if you're breathing in dirty air all night, that can also create inflammation, especially if you're dealing with allergens or if you have a lot of new furniture or carpets that are releasing chemicals, they're off-gassing things. You also want to make sure you're getting blackout curtains in your bedroom. The darker you can make your bedroom, the more easy it'll be for your brain to get down into that deep restorative sleep. The more light there is in the bedroom, the more that prevents the body from releasing hormones and chemicals like melatonin, and the harder it is to get down into that deep, restful sleep. We tried to get her to sweat, perspire for 15 minutes 3 times a week to help facilitate moving of lymph, to calm down some muscle soreness she was dealing with, but also to support the detoxification of the various organs in the body. One of the ways you can really do that is to help sweat or go into a sauna on a regular basis. And there's some pretty cool research now to show, this came out of Finland last year, that the more often people went into the sauna, say 3+ times a week, the lower their risk of heart disease and the longer their lifespan, which was pretty rad. We worked on some vagus nerve toning things. She didn't have a lot of extra money, so we couldn't get a vagus nerve stimulator. But we had her work on some breath work, some deep belly breathing, especially before meals, gargling some water in the morning, since part of the vagus nerve innervates the back of the throat, and doing some gratitude journaling. One thing that can be really helpful, especially if you're feeling very stressed or like you don't have a lot of extra things to give, is to just make a list, even if it just takes 1 to 2 minutes a day, of the things that you have in your life that you're really grateful for. And it doesn't have to be anything major. It can be something as simple as, I got to wear my favorite shirt today, or I called my mom and it was a great conversation. It doesn't have to be something big. Um, but the more often you can do that, even if it's just for 2 minutes a day, that can help to rewire the brain as well to remind us of the abundance around us rather than just the lack, and can help to get us out of that traumatized, pain, gut-focused mindset. We had her try to find some volunteer work, or to try and go on a date at least once a week with her husband, or to reach out to friends and hang out. Because one of the most powerful things you can do for your longevity and your overall health is to try to develop a more robust social network. So it really can be helpful to reach out to people in your life and try to strengthen those social relationships, because that will do more than just about anything to help support your longevity and your lifespan. She also decided that she wanted to try some nano-sized iron to help with the anemia, some magnesium to make sure that her gut was staying regular and calming the nervous system, because magnesium can also help that, as well as some choline. Choline, again, being the preferred substrate for that neurotransmitter used by the vagus nerve that's very anti-inflammatory. So after 3 months, her system survey revealed a few awesome things. Her rest and digest symptoms had improved 50%, so she was more calm, able to get out of that fight or flight and down into the rest and digest better. She was able to handle sugar and glucose much better. Being a vegetarian, she was often having foods that were really high in carbs, and that she wasn't tolerating that very well. Her upper digestive symptoms in the stomach, the liver, and the gallbladder improved quite a bit, about 60%. And her gut-brain axis, her brain to adrenals connection was improved about 70%, which was very cool since she was getting those cortisol spikes at night. So her brain was starting to rebalance, her ENS was starting to rewire and get reintegrated. She said her stomach pain had gone away. A lot of her muscle and body ache, pain, and tightness had improved. She had had more energy, less just feeling weakness throughout her body, improved mood, less anxiety, and her gut bloating was steadily improving over time. And this is just a little review this patient left for me. So you could see that she was pleased with the work we were doing together. So I want you to reframe how you think about your gut pain and your symptoms, and you're going to set yourself up for success in the long term. Because I think a lot of my clients and patients get really fixated on the idea that any sort of symptoms of all, any gut pain, any bloating, brain fog, any of that stuff means that there's some sort of active SIBO, there's some sort of microbial overgrowth going on, and that's not always true. Bloating does not always mean SIBO, does not always mean overgrowth. There can be a lot of different reasons for bloating, gas, intestinal pain, as we reviewed, all these different causes of the ENS being dysregulated. Your body can rewire and it can repair the gut nervous system. It just takes time in some cases because to facilitate that, we have to show your ENS some safety signals. Um, and that either needs to come first, or at least we need to do that at the same time as we're trying to help, correct the terrain of the gut lining, reduce inflammation, trying to rebalance the microbiome. Because if you either set yourself up with the safety signals first, um, I find that you can tend to calm down symptoms 30-40% just by doing that. But if you can do both at the same time, as long as that's not too much homework for you and you're able to integrate that into your daily life, that can just supercharge your progress. And again, these things take time. I'm a great example of this. I'm still working on my gut health sometimes. This last year, moving into practice by myself, having my own small business, raising 3 small kids, um, I didn't recognize for a while how much stress was taking its toll on my gut health. And so I've really had to take a step back and to change some of my lifestyle habits and work on my stress, and things have really improved. And I feel like back to where I was a few years ago before things really flared up. So remember, give yourself grace because this stuff takes time and it's okay. So going back to those enteric glial cells, as a reminder, these immune cells are the gatekeepers between the gut-brain axis. They determine whether the gut barrier, that gut lining, remains watertight and stable or gets dysregulated and leaky. They will determine how your gut has an immune response, whether it's creating inflammation or tolerance. And these glial cells, these white blood cells, are very sensitive to the microbes, the microbiota in your gut, and those other inflammation signals. You can see here that chronic activation of the enteric glial cells will promote inflammation dominant responses. So those white blood cells will release more chemicals, messengers called cytokines that promote inflammation. So when they're talking to other immune cells in your body, those immune cells, like T cells, if you remember from my immune system video, will determine, are we going to create more inflammation or are we going to create tolerance to these microbes in the gut, to these foods in the gut, to what we're being exposed to on a regular basis as it moves through the digestive system. And if you're having that inflammation dominant response, the other immune cells are going to perpetuate that, create more inflammation, and that can create things like food reactivities, food intolerances, and can lead to inflammation systemically. Because once the gut becomes dysfunctional, then bacterial endotoxin, LPS, those inflammatory cytokines, those immune cells can go to other tissues and create inflammation, joint pain, brain fog, um, skin issues. And that is often a common way that autoimmunity begins. Excuse me. Because those immune cells say that it becomes sensitized to gluten because of all of those inflammation promoting cytokines, those messengers saying, this is an enemy, be on the lookout for gluten. Those white blood cells will be marching around the body, and if they come across the tissue that's similar enough to gluten, say the thyroid or the cerebellum in the brain, or sometimes the coating on the outer part of the nerves known as myelin, they will start to treat that as an invader because they mistake it for gluten that they also think is unsafe for the body, creating autoimmunity like Hashimoto's, rheumatoid arthritis, multiple sclerosis, and it goes on and on. Excuse me. So again, if you have mood issues, remember to begin in the gut. 90% of our serotonin is made there. A lot of our GABA, dopamine, acetylcholine are made there, melatonin as well. And the ENS will help work to restore that mood resilience by producing a lot more of those neurotransmitters, helping to rebalance that response. So it can help with a lot of psychiatric things in people as well. Here's a case study of a 5-year-old girl I was working with. This preschooler was having frequent mood swings, a lot of just explosive yelling, screaming, crying over very slight problems like I dropped my crackers on the floor, just full on tantrum from things like that. Was getting UTIs over and over again, even though her parents, were trying to work on potty training and toilet hygiene. She was complaining of a lot of stomach pain, but her parents thought that this was likely related to a lot of anxiety that this girl was having at school. This girl wasn't really engaging with her classmates. They showed me a couple of videos of her during these dance classes where all the other students would be dancing and she'd be standing off on the side, just kind of watching nervously, just a lot of anxiety and complaining about stomach pain. And this girl had a lot of support. She had a child therapist. She had support from her teachers at preschool who are really trying to, help her get more engaged and to be involved. She was getting antibiotics for the UTIs, and her parents, were obviously involved because they wanted to take care of her and they brought her in to see me. So we did a comprehensive stool test, GI map, and that revealed a bunch of really key imbalances. So she'd had a recent food poisoning. She had a lot of different bacterial overgrowths that you can see over here. A lot of ones that I see really common. Um, Streptococcus, Staph aureus. The methane gas producing family was really high. So she was getting bloating and gas as well, even if as a 5-year-old, she wasn't able to articulate that really. Klebsiella. So a lot of these gram-negative bacteria that have that LPS that produce inflammation and cause pain. You can also see down here, her secretory IgA, her immune system was really overactive. It was responding as best it could to these overgrowths and this inflammation. And you can see this eosinophil activation protein was really, really high. It turns out she actually had an intestinal parasite as well. A couple days after we did this stool test, her parents said that they found pinworms in her stool. So had to get her some anti-parasitic support. Thankfully for pinworms, that's a really simple one that people can get over the counter, even from Walgreens. We had to work on some microbiome rebalancing strategies um, and helping to improve digestive function overall. And after 3 months of sort of steady work and trying to work on these things, she's still working with her therapists. Her teachers at preschool were still helping her, still trying to do these dance classes. She was engaging with classmates more. She was listening to her teachers. She wasn't having as many of those explosive outbursts of sadness or anger. She was able to have more resilience. Something that I thought was really cool was when she came in for a follow-up recently, she dropped her juice box on the ground and a bunch of juice spilled, and you could just see the feeling building up in her like it was about to explode. But she stopped and she took a deep breath and she went and got a towel and cleaned it up. And I was just so proud of her because this was a little girl who, honestly, it was kind of hard to work with her because she wasn't very compliant or willing to engage with me. And I think that's because she was just so anxious and stressed and dealing with so much gut inflammation. Um, and her therapist even reported some progression, less mood disturbance, more resilience, working with these different strategies. And you can see a message here that her parents sent to me. So now we're finally getting to some really great things that you can do for it. Nutrients that support the ENS, short chain fatty acids, again, butyrate, acetate, propionate. I want to hit that over and over again because this is one of the most important things you can not only do for your microbiome, but for your longevity in general. Because we need a really resilient, diverse microbiome, not only to help us break down and digest as wide a variety of foods as possible, but to help us when we're stressed, when we're sick, when we get food poisoning or infections. That'll help us bounce back from those things better. But those short chain fatty acids, again, they help to regrow the neurons in the enteric nervous system, and they help to regulate those enteric glial cells. They provide the food substrate to produce more energy in those nerves and the AGCs. L-glutamine, this is an amino acid, a protein that you can get in capsules or powder, and zinc carnosine, this is a specialized type of zinc. They help to heal the GI tract lining. So in people with gastritis, sometimes they find zinc carnosine helpful, even if they have to start low and slow to take it. In people with intestinal permeability, leaky gut, L-glutamine can be really helpful to help seal up those gaps in the intestine and to help regulate the gut lining. Magnesium, a couple forms that people tend to find helpful are magnesium glycinate, magnesium threonate, which is known to help cross into the brain tissue itself, or my personal favorite, Easy Mag by Standard Process, which is a whole food-based one. That one also is shown to cross into the blood-brain barrier in some ways more effectively than mag threonate, plus it's just made from food. So there's some research to suggest that mag-threonate may increase inflammation in the brain in people that are very inflamed or dysregulated. So for some people, Easy Mag may be a better choice. I also find that people tend to tolerate Easy Mag more in the stomach. Sometimes mag-glycinate, threonate, citrate can be too acidic or cause irritation in the stomach in some people, and Easy Mag tends to not do that for my clients and patients, from what I've noticed. They also help to calm the nerves. Magnesium is not just good for digestion by promoting regularity. So if you're constipated, magnesium can help move things along, but it also helps to soothe and calm hyperactive nerves. So whether that's in the central nervous system from stress, whether you're talking about the ENS and that hypervigilance that can help to calm that down. Acetylcholine and its precursors, choline is a supplement. Alpha GPC is another really common supplement. There's a lot of choline in eggs. This is the calming anti-inflammatory neurotransmitter used by the vagus nerve, facilitated through your spleen, that helps to just calm down inflammation that I talked about more in my videos on vagus nerve and in calming inflammation. And digestive bitters and herbals help to prime the gut, the vagus nerve, and the enteric nervous system for food. So having digestive bitters or things that are bitter help to stimulate the gut to get ready for digestion. Foods and herbs, again, the bitters, a couple of really good ones. Gentian that you can get in a glycerite rather than an alcohol is generally tolerated well by a lot of people. Iberogast is a common bitter combo formula that a lot of people with chronic digestive issues find helpful. Or even cocktail bitters can help to stimulate the vagus nerve and those reflexes in the enteric nervous system to promote the migrating motor complex, just if it preps digestion basically. Prebiotics, they help to feed the good microbes in the gut. A couple that people tend to find tolerable, at least in small amounts to start, PHGG, partially hydrolyzed guar gum, acacia fiber, and inulin fibers tend to be well tolerated by most, at least in small amounts to begin. Again, they feed the short chain fatty acid producing microbes, which gives energy for the ENS. Demulcent herbs, these are calming, soothing herbs like slippery elm, marshmallow that you'll see in a lot of different herbal formulas. They calm the enteric nervous system. They help to ease gut irritation and hypersensitivity. Sometimes they can be helpful for people with things like gastritis as well. Ginger and peppermint are also helpful. A couple products I've seen those in. IB Care, which is one that I carry in my clinic. IB Guard, which is a very common over-the-counter. I've seen at places like Walgreens, or even some fresh ginger, if that's not too spicy for you. Help to regulate the ENS. They help to support the promotion of those genes that regulate circadian rhythm and can help ease and soothe gut pain. Some bitter foods can even do that. Arugula, endive, radicchio, all of those strange ones that maybe you've seen in the grocery store that you've never tried before. Probably my favorite of those three is endive. Works very well in a soup. And that trains the gut. If you're done regularly, you can just have a bite of arugula, hold it in the mouth, a bite of endive. Because again, like digestive bitters, it's just prepping the gut to receive food. And you can retrain the ENS with several daily routines. Again, consistency here is key. Consistency is key. So you got to try to make these things predictable for yourself and for your body. Meal timing, having food or snacks at the same times every day, even if you have to set timers or reminders for yourself, can be very useful, as well as using bitters or sitting down with your food. And before you eat it, smell it, take it in, pray over it until you salivate. Once your mouth starts watering, then you're ready for digestion. You're out of the fight or flight and you're down in the rest and digest. Various strategies for activating the vagus nerve, which you can see in my video on the vagus nerve. You can get those vagus nerve stimulators. Mindful eating and breath work that helps to calm the fight or flight again, reduces gut hypersensitivity, gets the body ready to receive food. Making sure you're working on your sleep hygiene, and actually daily exposure to light, especially early in the morning, say when the sun is rising. You don't have to stare at the sunrise, but if you can get outside and be present with some of the early daily light, that also helps to align your enteric nervous system and your circadian rhythm with the rhythms of the day-night cycle, and that can help promote repair as well. Sounds silly, but a lot of us don't get outside in the early morning. Or if we do, it's when we're really stressed out and we're on our way to work or like dropping the kids off somewhere. So if you can do that early in the morning and get outside, get some light, even get some grounding, if you can put your feet on the earth or some grass, that can be helpful as well. So the final word, I know there was a lot of stuff. The gut is listening to you. So remember, 90% of those nerve fibers are connecting from the gut up to the brain, but the gut is not broken. Healing can happen. I've worked on my own gut healing for long enough now. I've worked with enough clients and patients that even issues that have been going on for years, maybe even decades, can improve and things can turn around. One thing to note is that you can't heal in a stressed nervous state, which is why it's so important to get down into the rest and digest. And that restoring your enteric nervous system allows the microbiome to help rebalance itself, sometimes even without having to take a lot of expensive supplements or antibiotics. And remember to give yourself time and grace. These things take time. Remember to think of it like a sprain strain injury. At first, you might take the antibiotics to kill an infection and go on the restrictive diet. But then the second half is to try and reestablish that balance. You got to do your PT or rehab, so to speak. So thank you so much for your time today. I hope this was very educational and beneficial. Make sure to listen to this again. Send me your questions, to watch this video in sections so you can take it in and to take notes. And yeah, thanks so much for your attention.